If you find yourself frantically scanning every restaurant, golf clubhouse, or grocery store for the nearest restroom the moment you arrive, or if you are waking up 3, 4, or 5 times every single night just to squeeze out a few drops, you need to know this. It might not be your prostate, it might not be a weak bladder, and it certainly isn't just an inevitable part of getting older. Millions of active seniors across the country are taking a daily prescription for their heart or blood pressure that is silently overstimulating their bladder, flooding their kidneys, or weakening the muscles that keep them continent, turning everyday life into a constant series of bathroom emergencies. I am Dr. Carl, a urologist with 16 years of clinical practice, helping men and women protect their kidney function and regain control over their daily routines as they age. In this video, we are going to walk through 5 very common blood pressure medications and daily prescription habits that secretly trigger bladder overactivity, nighttime waking, and sudden intense urges that can ruin a road trip or an evening out with friends. Pay close attention to number 4 on our list, because it is one of the most frequently prescribed blood pressure pills in America, and almost nobody connects it to the sudden loss of bladder control that sends folks running to the pharmacy aisle for pads and pull-ups. By the end of this video, you will have a clear, step-by-step game plan that you can bring directly to your next doctor visit so you can protect your heart without sacrificing your peace of mind or your sleep. Before we dive into our first medication, I want to ask you a quick, simple question down in the comments section below. How many times do you currently get up during the middle of the night to use the bathroom? And do you take a daily pill for your blood pressure? Go ahead and write your answer down below right now, because I read every single comment and your experiences directly shape the topics I cover in these videos to help other seniors just like you. Now, let's talk about the very first item on our list, thiazide and loop diuretics, which most people know simply as water pills, including common medications like hydrochlorothiazide, chlorthalidone, and furosemide. When your primary care physician or cardiologist prescribes a water pill, the intended goal is straightforward: to help your body flush out excess sodium and fluid to lighten the workload on your heart and lower the pressure inside your blood vessels. To understand what happens inside your urinary system, picture your kidneys as high-volume filtration plants connected to a main pipeline. A diuretic medication essentially opens up the floodgates at the kidney level, forcing your body to dump large quantities of water into your bladder over a very short period of time. When your bladder fills up 3 times faster than normal, the pressure inside the bladder wall spikes dramatically, sending urgent SOS signals along your nerves directly to your brain. This creates that sudden, overwhelming sensation that you have to go right this second, leaving you with barely enough time to cross the room. Research published in major medical literature, including reviews from the American Urological Association, confirms that diuretics are one of the leading pharmacological drivers of severe lower urinary tract symptoms and nocturia in adults over 60. Many seniors assume that their urgency is due to an aging bladder, when in reality, the bladder is simply reacting logically to an artificially created tidal wave of urine. If you are currently taking a daily water pill, one clear, practical action you can take this week is to check the exact time of day you swallow that capsule. If you are taking your diuretic in the late afternoon or right before dinner, you are effectively scheduling a major fluid surge to hit your bladder precisely when you lie down to sleep. Talk with your physician about whether taking your water pill first thing in the morning with breakfast could allow your body to process that fluid surge during the daytime, while you are awake and near a bathroom, rather than throughout the night. Never stop or adjust your medication on your own, but bringing this simple timing question to your next annual physical or Medicare checkup can be an absolute game changer for your sleep. Moving on to the second medication category that causes massive bathroom emergencies, calcium channel blockers, which include very common names like amlodipine, nifedipine, and diltiazem. These medications work wonders for relaxing tight arterial walls, making it much easier for your heart to pump blood through your system. However, they carry a very specific physical side effect that millions of seniors experience every single day without realizing how it impacts their bladder. Here's the everyday mechanism of what is actually happening in your body. Calcium channel blockers tend to cause fluid to leak out of your small blood vessels and pool in the lower extremities due to gravity throughout the day. If you notice that your ankles look a bit swollen by 5 o'clock in the afternoon, or that your socks leave deep indentations around your calves after a round of golf or an afternoon with the grandkids, you are seeing this process in real time. When you finally lay flat in bed at night, gravity stops pulling that fluid down into your feet. Your circulatory system pulls all that pooled liquid back into your bloodstream, sends it straight to your kidneys for filtering, and converts it into a massive volume of urine while you are trying to rest. Studies highlighted in the Journal of Urology show that this evening fluid shift, known clinically as nocturnal polyuria, is a primary reason why retirees find themselves making 3 or 4 trips to the toilet every night despite drinking very little water after dinner. It isn't that your bladder is small, it's that your ankles were storing half a gallon of fluid all afternoon that suddenly gets dumped into your urinary tract the moment your head hits the pillow. A great action step you can start using this week if you take a calcium channel blocker and experience ankle swelling is to elevate your legs above the level of your heart for 30 to 45 minutes in the late afternoon, around 4 or 5 o'clock. By propping your feet up on a few pillows while you read the evening news or watch a show, you encourage that pooled fluid to return to your heart and be filtered out by your kidneys while you are still wide awake and active. Once again, bring this pattern up with your doctor, as they may want to evaluate your dosage or suggest supportive compression socks to keep that fluid moving smoothly throughout the day. The third medication on our list is a class called alpha blockers, such as doxazocin, terazosin, and prazosin. These drugs are somewhat unique because they are frequently prescribed for blood pressure, but they are also used to treat an enlarged prostate in men. While they can be very effective at relaxing smooth muscle tissues, they can create unexpected urinary chaos, particularly for women who are prescribed them for hypertension or for men whose bladder neck becomes overly relaxed. Think of your bladder as a water balloon with a tight rubber band wrapped around the neck to keep the fluid inside until you are ready to release it. Alpha blockers work by relaxing the smooth muscle fibers around that bladder neck and the blood vessel walls. While this lowers systemic blood pressure and makes it easier for urine to flow, it can sometimes relax that protective outer sphincter muscle just a little bit too much. When you cough, sneeze, laugh, lift a heavy bag of mulch in the garden, or swing a golf club, the sudden pressure inside your abdomen can easily overpower that softened sphincter, leading to sudden spurts of involuntary leakage or an instantaneous, uncontrollable urge to rush to the restroom. Medical literature from urological societies emphasizes that medications affecting smooth muscle tone can significantly alter bladder storage dynamics, worsening what urologists call stress urinary incontinence. Many seniors suffer in silence, feeling embarrassed or believing their body is failing them, when the culprit is simply a chemical relaxation of the muscles designed to keep the bladder sealed shut. If you suspect your blood pressure pill is causing unexpected leakage or intense, sudden urgency, your practical step for this week is to start keeping a simple 2-day bladder diary. Jot down the time you take your medication, what you drank, when you felt an urgent need to go, and any instances of accidental leakage. Taking this written record into your doctor's office gives your healthcare provider actionable, real-world data, allowing them to adjust your treatment plan or explore alternative medications that protect your arterial health without weakening your bladder control. Now we come to number 4 on our list, the specific issue I teased earlier that catches so many active seniors completely off guard: AC inhibitors, which include extremely popular drugs like lisinopril, enalapril, and ramipril, especially when combined with a persistent nagging tickle in the throat. Millions of seniors take these medications for years with great blood pressure readings, completely unaware of the collateral damage happening to their pelvic floor and bladder stability. Here is what is happening inside your body. AC inhibitors prevent the breakdown of a substance called bradykinin in your lungs and airway. In a large percentage of patients, this buildup triggers a dry, hacking, repetitive cough that simply will not go away, no matter how many cough drops or glasses of water you try. Every single time you cough, your diaphragm slams downward, creating a massive, sudden spike in intra-abdominal pressure. Picture squeezing a plastic water bottle with the cap loosely screwed on. That sudden compression forces liquid past the bladder valve. Over time, months or years of chronic daily coughing from an AC inhibitor physically fatigues your pelvic floor muscles, stretching them out and leaving you incredibly vulnerable to sudden bathroom emergencies and stress leakage whenever you move quickly, laugh, or cough. Clinical reviews published by major academic medical centers like the Mayo Clinic consistently point out that medication-induced chronic cough is a major, yet frequently overlooked contributor to secondary urinary incontinence in older adults. The tragedy is that many seniors undergo invasive bladder testing or begin taking additional bladder medications to manage the leakage when the entire chain reaction was started by a subtle side effect of their daily lisinopril. If you are taking an AC inhibitor and have had a persistent, dry cough for weeks or months alongside new urinary urgency or leakage, your action step this week is to schedule a conversation with your prescribing doctor. Ask them directly if your cough could be related to your blood pressure pill and inquire whether an ARB or angiotensin receptor blocker like losartan or valsartan might be an appropriate alternative for you. ARBs work on a similar pathway to protect your heart and kidneys, but do not cause the bradykinin buildup that triggers that chronic, pelvic floor weakening cough. Never stop taking your blood pressure medication abruptly, but know that safer, comfortable alternatives exist. This brings us right to our halfway mark, so let's take a quick pause. If these insights are helping you connect the dots about your own health, please take a quick second to tap that like button down below. It takes less than a second, but it tells the algorithm to share this video with thousands of other seniors who might be struggling with these exact same nighttime disruptions and bathroom emergencies. And while you're down there, tell me in the comments, have you ever noticed your bladder acting up after taking your morning or evening medications? Moving along to number 5 on our list, beta blockers, such as metoprolol, atenolol, and carvedilol. These medications are absolute workhorses for controlling heart rate, preventing arrhythmias, and managing high blood pressure, but they can subtly alter how your nervous system communicates with your bladder muscle. Your bladder wall is made up of a specialized smooth muscle called the detrusor muscle, which relies on a delicate balance of nervous system signals to stay relaxed while filling up and to contract when it is time to empty. Beta blockers interfere with certain beta-adrenergic receptors that normally tell the bladder wall to remain relaxed and expanded as it collects urine. When those receptors are blocked by your daily heart medication, the detrusor muscle can become irritable and prone to tiny, involuntary spasms while your bladder is only partially full. You experience this as a sudden, sharp urge to urinate, even though your bladder may only contain a few ounces of fluid, leading to frequent, frustrating trips to the bathroom throughout the day, where very little urine actually comes out. Urological research suggests that autonomic nervous system modulation from cardiovascular drugs can alter smooth muscle tone in the urinary tract, leading to symptoms that mimic an overactive bladder. Seniors often find themselves constantly mapping out public restrooms wherever they go, believing their bladder has shrunk when in reality the muscle tissue is simply receiving altered nerve signals due to their cardiac regimen. If you are on a beta blocker and experience frequent, small-volume urination accompanied by sudden urgency, your practical step this week is to focus on simple pelvic muscle retraining, often called timed voiding. Instead of running to the restroom the very second you feel a mild urge, try sitting down in a comfortable chair, taking 3 deep breaths to calm your nervous system, and holding for just 5 to 10 minutes longer. This simple practice helps re-educate your detrusor muscle, reassuring your brain that your bladder is not actually full and helping you break the cycle of constant, small-volume bathroom runs. I am Dr. Carl. Stay well, and I will see you there.